All right, team, the patient presents with condensing ustatitis, synovitis, and dermatopolymyositis. What are we thinking?
Those symptoms could indicate a few different conditions. It could be rheumatoid arthritis or even systemic lupus erythematosus.
I'm leaning more towards dermatomyositis. The muscle weakness and skin rash fit the bill.
What about sarcoidosis? It can have similar symptoms to what we're seeing here.
Not so sure about those. I think it might be adenosine deaminase deficiency. The symptoms align more closely with that rare disorder.
Frank, you're spot on. It is indeed adenosine deaminase deficiency. We need to act fast. This patient requires auriculectomy.
Auriculectomy. That's a risky procedure, Hawks. Are you sure about this?
Damn it, Gary. I didn't spend years studying medicine to second guess myself. It's a risk worth taking. Prepare for surgery. Tracy, I need your approval to perform auriculectomy on my patient. I strongly believe they have adenosine deaminase deficiency.
Hawks, have you considered all the other possibilities and consulted with other specialists before jumping to such an invasive procedure?
Yes, Tracy, I have. I've been a doctor for 20 years, and I know when I've diagnosed a rare condition like this.
Hawks, I understand your dedication to your patients, but you have a history of misdiagnosing. Remember the last time you wanted to perform a Whipple procedure and it turned out to be a simple case of food poisoning?
That was one mistake, Tracy, one mistake. You can't keep holding that against me.
Hawks, I'm not trying to hold it against you. I just want to make sure we're making the right decision for the patient. Let's get a second opinion before we move forward with the auriculectomy.
Fine, Tracy. But mark my words, I am right about this.
Leslie, we have a critical situation here. The patient is not responding well after the auriculectomy.
Oh no, that's not good. What are our options now?
I think we need to inform Hawks that auriculectomy was not the right treatment for adenosine deaminase deficiency. We need to act fast to save the patient.
But do you think Hawks will understand? I'm more worried about the patient right now than what Hawks will think.
I understand your concern, Leslie, but we can't delay this conversation any longer. We need to be transparent about what happened and focus on saving the patient's life.
Oh, how could you all be so incompetent? You nearly killed our patient with the wrong auriculectomy area and misdiagnosis.
I was sure it was a case of otitis externa, Dr. Hawks.
But the symptoms were more in line with otitis media, I swear.
I still think it might be mastoiditis, Dr. Hawks.
No, it's definitely Meniere's disease. I'm positive.
You're all a bunch of fools. You couldn't diagnose a common cold. I'm done with this incompetence. Good luck fixing your mistakes because I'm out of here. I can't stop thinking about this medical case, Johnson. It's consuming me.
Well, sometimes it's good to take a break from work and focus on your personal life. Speaking of which, things are finally looking up for me outside the hospital.
That's great to hear, Johnson. But wait a minute. I think I've just figured out what's wrong with my patient. I need to go. Sorry, I'll catch up with you later.
Well, that was shorter than usual. Guess I have time to finish both our lunches.
Don't even think about it. I have a new diagnosis for this patient. It's cystinosis.
What? Hawks, you can't just storm in here without proper protective gear.
Yeah, it's against protocol. You're putting everyone at risk.
Do you have any idea how serious this is? Adenosine deaminase deficiency was our working diagnosis.
I'm aware, but I have reasons to believe it's cystinosis. The prognosis for cystinosis is poor, but with early detection and treatment, it can be managed.
Well, let's not jump into conclusions. We need more tests to confirm your diagnosis.
I agree. We can't just switch diagnoses without solid evidence.
Hawks, we understand you're passionate, but you have to follow the rules, especially in the operating room.
I hear you all, but trust me on this. Let's order the test and see if it confirms cystinosis. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. Well done sorting that out.
Thanks, but this whole ordeal with the wrong diagnosis wouldn't have happened if I didn't have such idiotic doctors to work with.
What do you mean by that, Hawks? You're the one who declared the wrong diagnosis in the first place?
Well, my diagnostics team should have caught that error before I did.
Hawks, you can't shift the blame when you were the one who made the wrong call.
I don't need to listen to this.